It is now my privilege to introduce Ambassador Sally Cowal from the American Cancer Society.
Well, thank you very much. Muchísimas gracias a todos ustedes for the invitation to be with you here today. A lot of my life has been spent in Latin America and the Caribbean. I have lived in Mexico and Colombia and in Trinidad, and I know that we are really one region. And so what we can work on in Miami and what we can work on all around the region to help women in all of our countries survive and prosper is something that we're beginning here today in a very abbreviated journey. I also want to thank the University of Miami and this wonderful Center for Jewish Life at the campus of the University of Miami for hosting us today, and to wish a wonderful Shana Tova to everyone for a prosperous new year ahead. I'm going to skip all the things that I had to say about the silos in women's cancers and the necessity of integrating women's cancers and eliminating those silos because A, we don't have much time, and B, it's already been said by almost all the speakers here today. So I just want to take the few minutes that I have to talk about how my organization, the American Cancer Society, is trying to move from just talking about these things to actually doing these things through some experimental programs that we can ensure that breast and cervical cancer prevention and early detection become a norm, not just in cancer societies, but in reproductive health, maternal health, and primary care settings. So the new program that we're planning to launch is called All of Me, or Todo Mi Ser in Spanish. And it's a program that will work with local cancer organizations to promote more effective education about prevention and early detection in new settings that may not and probably are not now addressing women's cancers. So we're working on the premise that an effective way to reach these women is through reproductive health and primary care clinics. And therefore, we're supporting work with OBGYNs, pediatricians, family physicians, nurses, community health workers, and other health providers to identify and implement solutions that work in these settings. And All of Me also places special emphasis on the settings where underserved women receive most of their care, and that's not in specialized cancer centers. And we also want to break down these silos that Mona was talking about that address cervical and breast cancer education totally separately. In fact, we really think education is one of the channels through which we can start building the synergies across women's cancers. So Todo Mi Ser came in part from the realization that we need to cultivate champions, like we heard John Ciccato this morning, and promote innovation on how to improve cancer messaging to make certain that more women have access to accurate information about cancer, and that they're comfortable having conversations, not only about breast cancer, but about cervical cancer, and that these conversations reach topics far beyond their narrow cancer risk, but about their bodies and their health, so that they feel empowered to seek prevention and early detection services. A few of you in this room are old enough to remember a seminal publication in the United States in the 1970s called Our Bodies, Ourselves. And that really began to open up the conversation about women, their reproductive health, and really their empowerment. Because we know that then in our country and still in many countries around the world, a lot of myths and misperceptions about cancer abound, especially around cervical cancer and HPV vaccination. And more worrisome is that some of the key actors that women get their information from, including providers, actually reinforce these myths which is why the All of Me program focus on these actors is particularly important. I mean, we know this even in the United States, where HPV vaccination is only at about 32%. And that's partly because providers don't mention it to women who come in with their adolescent-age children. They wait for the family to bring it up. So we're now working with the CDC at the American Cancer Society to improve our work with providers, and that's what we want to do in Latin America as well. So we're piloting All of Me, Todo Mi Ser, in Brazil, Colombia, and Mexico in 2016 and 2017. And we've recently identified the local cancer organizations that will serve as the implementation partners in each of these countries. And their work will start before the end of the year. And these local partners are really critical to the success of this program, and really to every effort to address women's cancer burden in Latin America. Because we know that people are more empowered than they ever were before. They're the key to change. They're asking their governments, they're asking their doctors, and our civil society partners are really the key to reaching into the communities. I think that's another lesson we learned from the HIV/AIDS epidemic, is that we need to reach into the communities. So we're partnering with some of the most effective and well-respected civil society organizations to implement these programs. And I'm sure you're familiar with these organizations, and some of them are even with us in this room. In Brazil, we're working with FAMAMA and Dr. Mayra Kalefi, who should have been here today, but who was prevented from reaching Miami by the supposed Hurricane Matthew, which may be out there somewhere. As a part of All of Me, FAMAMA will work with the basic health units and family health teams in some of Porto Alegre's most populous and vulnerable districts to identify common solutions to enhance the role of community health workers as promoters of women's health information. In Mexico, we're partnering with Felicia Knoll's group, Tomatelo a Pecho, and Tomatelo a Pecho will lead the establishment of a multidisciplinary working group on women's health and collaborate with public health institutions in Mexico to promote this integrated approach to breast and cervical cancer among health providers. And in Colombia, we're working with the Fundación para la Prevención y Tratamiento del Cáncer in Cali, and the Liga Colombiana contra el Cáncer in Bogotá, and Señora Pilar Fernández from the Liga is with us today. The foundation will scale up their existing cancer prevention work with primary care physicians of the Red de Salud Ladera, a network of low-complexity health providers serving vulnerable groups in Santiago de Cali. The Liga will use a cascade method to engage providers from its own clinics to provide membership and training on breast and cervical cancer education to primary health providers in their respective communities. We're also partnering with the International Society for Nurses in Cancer Care to support the expansion of their existing training on the prevention and management of cervical cancer for nurses and community health workers in all 3 countries. So as you can see, All of Me is supporting several different provider training opportunities throughout the region, and will be engaging our implementation partners in strategic discussions about how best to develop these sessions. We'll also be sharing some key information, education, and community materials from the American Cancer Society, which has 100 years worth of them stored in its basement, for adaptation to meet the needs of our local implementation partners. Because truly, knowledge is power, and we hope that by getting the right groups involved, we can give women the tools they need to make the best decisions for their health and influence governments to do more to keep women healthy. Now, I realize the idea of leveraging existing health infrastructure to tackle women's cancers and ensuring health systems are trained to address women's prevention and early detection needs is nothing new. Global health leaders have been talking about this for years, and we continue talking about it today and in this room. And there's also been a lot of talk about how to avoid creating these silos in our own community, which we sometimes do when we try to educate women about one cancer, but not about others. What all of me is an attempt to put these ideas into practice. We see this program as an opportunity to test new creative approaches to cancer education and to start implementing some of the ideas that we're talking about in the community. We don't yet have data to guide our efforts or really best practices to show us what works. So this program will be an important learning opportunity. And throughout this pilot program, we'll continue to refine it, expand on the ideas that work, and discard those that don't. Eventually, we aspire to expand the program to integrate even more wellness issues that affect women, such as lung or colorectal cancers or smoking cessation. And that will further reinforce the goal and the meaning of all of me, or our bodies and ourselves. So I think our opportunity here today cannot be overstated. We have highly effective prevention, early detection, and treatment tools that hold the potential to transform the lives of millions of women. And it's not just a health issue. It's an equity issue. It's a human rights issue. And we must approach this with the same passion and impatience we did with maternal mortality and HIV and AIDS. I don't yet see that passion here. We need to have it. We have an HPV vaccination. We've had it for 10 years. All the years I worked in HIV and AIDS, people went around saying, oh, if only we had an HIV vaccine, if only we had an HIV vaccine. We have an HPV vaccine. It's enormously effective. When are we going to start using it and integrating that into our adolescent and reproductive health programs? Because women really deserve better. And I often say that where you live shouldn't determine if you live. And it also shouldn't determine your access to accurate health information, to knowledge that can empower you to take action on your own health. Because every woman deserves quality to health care in education, prevention, and treatment services that could save her life. And working together, I know we can make sure that they get it. So thank you all.